So, welcome to the channel. It's Dr. Durst, and I have my co host with me.
Hey guys, Faraday Golembiewski, family nurse practitioner here at RevitalyzeMD.
So, today we have a fun podcast. So, we reached 50,000, and that was
Woohoo!
us
Thanks,
doing,
guys.
just some, basically a podcast on the side, like when we have time. So, we're focusing in on that now, but we also want to have a little bit more fun with it. And so, this one, as a thank you, we're going to do a fun episode because, again, we've both been doing medicine for a long time, and
Mm-hmm.
now we do a medicine that we're very passionate about, and it's awesome, but it's not where we started by any means.
No, it's a
And
lot more fun
so,
than where I started.
yes, and where I started too. And so it's interesting. What prompted this is I was the other night just needed 30 minutes of like just a no, and I'm very infrequently saying I don't want to do brainless activities.
This is a brainless. You
But this
wanted
was
a
a
brainless
brainless.
activity.
So I was like 30 minutes of, I'm going to just find something fun. And Grey's Anatomy popped up, and my kids used to have me watch this with them. And so I'm like, well, let me just turn it on. So it was the first episode ever of Grey's Anatomy. So they were just getting started. So it was their first day of residency.
Yeah.
And it was the whole episode was like 7 hours of their first shift and the shit that they had done in the first 7 hours. Like they had met, basically
Yeah.
been told they would fail, had been yelled at,
Yeah.
had done hours of rectal exams for some, surgery, seizure control, lost in the
Yeah.
hospital. It was nonstop. And then by the end of it, like you had seen so much, and then it was like, so we got through our first shift and our first shift of residency. So again, I just thought back to just how true that actually was because
Yes.
my first shift in residency, and I did ER, so I did an ER residency. So you basically you're training, and Faraday's going to go into like you train and then you do more training and then you specialize. And so I did med school and then I went to an ER residency program and was board certified ER. So my first 3 years, your internship is your first year of residency, and then you have 2 years beyond that. It was a 3-year program. And so on the first day, which is July 1st, by the way, and we'll do another, episode of that in July, just saying that July 1st is the first day for all interns
Yeah.
in hospitals. And I was on trauma. And it was
So
24
don't go to the
hours.
hospital the first week of July.
Yes, don't. Yeah, correct. Correct. You do not want to go the first
Don't
day
go.
of July. This is like the start of my story is it's
Yeah.
July 1st and I'm starting, and my first day is my trauma rotation. Trauma was, again, you did a rotation for a month, and it was 24 hours on and 24 hours off every other day. And
Yeah.
so every other day I was in the hospital for 24, but it's not just 24. After
Do they
your
still
shift,
do
then you've got
24-hour
to,
shifts? I feel
no,
like
they have softened things
I
a
know when I left the
lot.
hospital, they were talking about the ER not doing 12 hours anymore and bringing it
Oh,
down to like
yeah.
6 and 8 hours. And I'm like, how nice for them.
Yeah, no, I mean, no. Well, I'm sure they don't. So now they have a cap. I think it's 80 every 2 weeks, hours wise. So that would kind of eliminate that, right?
Yep.
You'd be at 50 in 2 days
Yeah.
and or 4 days. So basically it was 24 hours on, 24 hours off, and then you're actually over because you're always charting and finishing things up. So 24 hours doesn't mean that. And it was residency, and it's July, and it's Cleveland, Ohio. That's where I did my residency. It's a trauma center up there. It's a county hospital. So we were the regional trauma center. And essentially in July, everyone is out playing, right? Because it's
Right.
fun. And July 4th, by the way, is like
So you've got
firework and
fireworks,
yeah.
you've got motorcycles, you've got car accidents, you've got
Yeah.
boating accidents. We're all out and about.
We're out and about, and we used to call it motorcycle season. I didn't call it that on July 1st of my internship year because I didn't know that yet. But anyhow,
But that's what
motorcycle
it's
season
deemed.
is like you had all these motorcycle accidents. So I'm on my trauma rotation, and we are getting killed, and we're in the trauma. We're getting paged down to the trauma, the trauma room all the time. And we had 4 trauma beds. And so at one point, all of my upper level residents were all busy, and I'm in charge of the people on the floor. And one
Yeah.
was going south. And here I am knowing nothing. And this is why you don't go to the hospital on July 1st, because you graduate, you're a physician, And now all of a sudden they think you're ready to make decisions. Actually, most of the nurses know you're not ready to make
Yes.
decisions, so they protect the patient. So that's a good thing.
Former nurse.
Yes. And so they know that July 1st in a residency hospital is not a good time because they have now I'm a physician. So I'm no longer a medical student. I'm a physician. So they're looking to you for orders and answers, and I don't know what I'm doing, right?
And
And
sometimes
I'm,
it's like, hi, I need these orders. Will
yes.
you please sign?
Yes. Oh no, they were so awesome at helping. In fact, my the first day of residency, they gave us like a list. I have to find it, the 10 commandments of residency, the nurses. And it basically was like there is only a wide open or a KVO, keep vein open. We don't do drip rates in the ER. We don't do repeats in the ER. We do like we are your boss in the ER. It was like the nursing commandments to the
I
residents.
love that. I
It
would
was the
love to
first.
see that.
I have got to find it because it was the first day and it was awesome. But basically, yes, I suffered through trying to get my upper level residents to help me take care of a critical patient on the floor, and it was just disastrous. But by the end of 24 hours, I had seen everything: gunshot wounds, motorcycle accidents, smash heads, lacerations. Like it was everything. And again, you just got to recall that, like, I don't know what I'm doing.
And I want to caveat that a little bit, right? So we go to school. So for me, it's a little bit of a different path, right? So I was a registered nurse. I went to nursing school. We do our residency very differently than physicians do. But to be an RN, I have to do my rotations on different floors and kind of go through all those different steps as well. And then back to school to be a nurse practitioner with another residency that follows that program as well. But what you learn in the classroom is textbook. How many times in life do things go by a textbook, right?
Yeah, no.
They just don't. So hands-on experience is so important. So when we say we get out of school and we don't know anything,
We know the
we know
books.
things. I
Yeah.
mean, we went to school, we got an education, we passed all the boards, we have a piece of paper that says, I'm a nurse or I'm a nurse practitioner or I'm an ER physician, but we don't know anything. You
No.
go in and it's like, well, my book on page 271 did not say this.
Yeah. No.
Can't reference that.
No. And the teachers are like that too. So if you just think about common sense, so there are really smart people with no common sense, right?
Yeah.
That's a perfect example. So here are some really smart people with a lot of knowledge, but
But
no
no hands-on,
application.
no
They
application.
haven't, and they have because they rotate through with medical school, but not to the degree. You don't get real life education until you are learning under fire in those situations. So in 3 years, how much did you learn?
Exactly. So, right,
So,
we were talking about this a little bit earlier off camera, and I'm like, you don't pull out anything you don't put in. And you gave the perfect example, right?
yeah.
Of if a if a joint is out,
Yes.
right? If you dislocate something, the books say don't put it back in if there's a fracture.
Yeah.
But what happens in real life?
They tell
You
you
put
to
it
put it
back in.
back in and you put it back in. Yeah. Like, so, but at the beginning of it's interesting because even sometimes through residency, you're still kind of taught something, but then then step it and play it forward. You
Yep.
get out
First
into the
day.
real world, and now you're at a community hospital. It's the middle of the night, and no one's coming in. You don't have all the support of a residency program. And so now all of a sudden it's just you. And you're doing all the things that you didn't do when you had an ortho team and a trauma team and a cath team,
Yep.
because that's all you have. But anyhow, it's interesting because yeah, you have a lot of smart people that know a lot of things, but they're just babies. They're babies
No.
in that
And when
field.
you think about even when we went through versus now, I feel like there is it's softer now,
Oh,
right?
it's
Because we
much
were
softer.
talking
Yeah.
about that. Like see one, do one, teach one. If the nurse I was with showed me something once, there was zero reason why I was not expected to do it the second time.
Yeah.
And if I was like, no, I hadn't seen that, she's like, well, you're not going to learn unless you do it, so go ahead and do it. It's expected, and you do it, and that's how you learn.
Oh,
Now
yeah.
it's lots of chances, lots of go, lots of learning. Let's keep going and keep going. It's not necessarily that's wrong, but it's very different.
Yeah, it's very soft now. Like, so even when we are, frequently seeing patients and treating from an office standpoint. I think the difference is what you said is key. Things aren't textbook. And so things are going to happen. Patients are different. Approaches are different. Somebody needs this that day, but you didn't know. And now they're in the office and they're in front of you and you're making things happen. And that's just medicine.
Hmm.
But now, if you kind of change things up on people that aren't used to that, again, younger in their career, just starting, they're not used to all that being thrown at
Yeah.
them. And they think it's abnormal, but you can't have coddling. Like, there is no coddling at our office, just so you know, like, our staff are on it.
Are amazing.
Yeah, because we don't do girl drama, number one, and we don't cuddle because we just expect you to be great at what you do. And so
Be
that's a
the
good fit for
best.
our
Do
office.
the
Yeah,
best.
yeah. It ends up being a good fit for our office. But anyhow, what some interesting things, because when you were talking about that, it was even like, nails and hands. And, it's the first day and you're seeing it and they're telling you to take it out. And you're like,
I didn't put
you
that
want
in
me?
there. I'm
Yeah,
not yanking it
yeah,
out.
yeah. Like, how do I take that out? Like, what do you mean? Just take it out, And so you learn just by being told what to do. But the funny thing about that first episode of Grey's Anatomy and the realistic part is we're getting yelled at
Constantly.
all the time, belittled, yelled at, made fun of. It's just what happens, and that's a realistic part of it.
And you learn through it. And you
Yes.
get stronger and you don't make the same mistakes.
Yeah, so you can't really be soft with training in medicine and period across the board because otherwise doctors aren't social workers for a reason because they don't all have
I
good
like that. No, you are not.
no, they don't have a good bedside manner, some of them. They just don't. If they did, they would be social
It wouldn't
workers
be.
and they would be doing small group therapy with people, but that's not their personality, right?
Yeah,
And so you have to, like, you spend all the time learning, you're applying it, but they aren't all that soft. And
that's
so
it.
they have personalities because they're driven and they're smart and like again, advanced professionals overall in medicine.
Yeah.
And so they're not always the nicest to work with. But I personally, if I was having brain surgery, I would want the guy that's best at the
I
brain
want the
surgery.
cockiest, most confident
Brain surgeon, period.
surgeon.
I don't care how nice he is. I
Yeah,
just
could care
want him
less.
to be good at what he does.
Yep.
That's what we're talking about. So if just niceness matters, then you may not want that surgeon operating on your brain. And so there's different personalities in medicine that will always happen. And so people can't be all that soft in life, like
Yeah.
because we have to be able to take criticism and take feedback and learn under fire and just part of what happens,
And
right?
strive to be better.
Yeah.
So nurses are notorious for eating their young, as they say. But what we do isn't life or death, but sometimes it is,
Yeah.
right? Some professions, some areas of medicine are, and I think that is why nurses are so hard on each other when you're learning. It's why physicians in residency, it's not meant to be easy because you're meant to, you may be in a situation where you're making these life and death situations and you have to be able to do them and you have to be able to do them immediately. It has to be second nature and you can't second guess yourself. You
Yes.
just got to, and I think that's probably why it was like that. That's in my head. That's how I validate it.
Mindset and confidence for sure. And so yeah, because you can't sit there when somebody's yelling at you and you're just learning it and of course you sound stupid, but they're impatient, and they're ready to in this life and death stuff and they're not expecting you to be an intern and to be I mean, they're used to it. They are expecting it, but then they just,
I
take
remember my
advantage of
first
it
day.
and
I'm
they
like,
just
hi, I'm
they
here. I
yell.
have no idea what I'm doing.
Yeah.
I felt so lost. Like there are just days you get it handed to you in the hospital and you just like the blows just keep going and you're like, okay.
Yeah. I think back to what I wouldn't do, and we were telling this story earlier, what I wouldn't do when I was even a practicing ER doc. So we're talking about like residency, we can tell story after story. Then you get out into the real world. Now you're in a community hospital, how you approach things is different, and you don't like somebody's not coming in the middle of the night. So in a residency program, with all the attendings and all the different
You have a
residency and
savior.
learning. I have somebody that's coming to help me. I have a savior. So I have a urologic problem, and priapism is one of the problems you can have from a male urologic, where you have an erection that lasts.
Longer
And
than 4 hours.
longer
Remember
than
the
4 hours.
commercials for the little blue pill? If you have an erection that lasts longer than 4 hours, go to the ER.
Yeah.
Contact your healthcare professional. It's on
Yeah.
every commercial.
Yeah, and somehow
Because
we
it's a
came
real
back
thing.
as on one of our podcasts we came back to erections, but this is actually a good stopping point for this one. How odd that is, right? But I had a savior, so I could call urology, and the urology residents or fellows would come down, and then they would end up taking over. So they would withdraw blood if they needed to, or they would inject the penis with something that reverses the priapism. And you had to do that. That's an emergency situation. And so you can't allow that to go on, because it could become ischemic and it can affect a male's function. And so you don't have time to waste. And so now all of a sudden, fast forward, and I am in my first job, and it was a smaller hospital in Florida that I was working. And it was not tiny, but it was smaller than my residency
Oh, I
program.
didn't know what you were going with there.
Yeah,
I'm like,
no.
okay,
So
Deb.
I'm at night. It's in the middle of the night, and I'm on my by myself, and I have a guy come in with priapism, right? So I'm calling urology, and it's 3 in the morning, and urology is not coming in at 3 in the morning in a small community hospital unless they have to. They will come in, but it has to be, you need them for the OR. Urology is a surgical specialty. They're not coming in unless they're taking them to surgery when you're in a community hospital. And so now all of a sudden they're telling me to go withdraw the blood, and to
Inject the
inject the penis.
medication.
Now, my first thought was, I don't inject penises. Like, I don't
I
inject.
believe you said, I don't inject penises.
I don't
hands
inject.
up.
Yep,
No,
I don't
thank you.
inject penises. That is not something I do.
And my response is, well, look how far we've come.
Look how far we've come. So now I inject penises. So I started actually in that time frame, because nobody was coming in the middle of the night, and we didn't want that to go on, and it was an acute emergency. So I learned then, but now that's what I do for a living. So and I'm passionate about
Yeah.
it too. So look how far we've come.
Full circle.
Full circle. So it's amazing what you'd be forced to do, and over time and we can tell different stories. We want to start doing even maybe some reaction stories. And so we are doing this little fun video just because I watched that Grey's Anatomy. It
And
was
when we
hilarious,
watch
and it was
Grey's
true.
Anatomy or Scrubs or ER, any of these, there are so many times where we watch it and we're like, no, that is not real. That is not how that goes. But this one, it was very realistic.
It was very realistic, because they were thrown a ton of different things. It flashed back to my first day of
And they're
my
all running
trauma
around knowing
rotation.
nothing.
And yes, and by the time I left that, I was exhausted and surprised I made it through. And now, fast forward to 25 years later, and I can look back now at those stories, and it's actually even so far off. It seems so long ago, but it's
And
immediate
now they're
recall.
funny where they weren't funny
Yeah.
at the time.
No, they were not so funny at the time, but still we handled it. So anyhow, we'll do more of this. This was like a just quick episode of us flashing back to days, and we went on prior to about all kinds of different stories. So at 50,000, this was our little give back of just a fun episode about our prior life experiences in medicine and where we are now. But we want to do these on a regular basis. So let us know if there's anything that you want to hear more about. And if we get to 75, we'll do one for sure. So like, subscribe, let us know, comments, anything you want to hear about, because we're willing to deep dive into anything, obviously.